How to treat and cure bedwetting. Most children gain bladder control over time without any treatment. Bedwetting that continues past the age that most children have nighttime bladder control, typically at 5 or 6 years of age, also will usually stop over time without treatment. If not, home treatment may be all that is needed to help a child stop wetting the bed. If home treatment is unsuccessful, if the child and parents need assistance, or if the bedwetting may be caused by a medical condition, medical treatment may be helpful. Medical treatment may help your child wet the bed less often or help him or her wake up to use the toilet more often. Treatment for bedwetting is based on the child's age. Some treatments work better than others for children of a specific age group. Child's and parents' attitudes about the bedwetting. If gaining bladder control is seen as a normal process, it is usually easier for the child to stop bedwetting. Home situation. If the child shares a bedroom with other children, certain techniques to arouse the child, such as some moisture alarms, may not be practical. Treatment for bedwetting may include motivational therapy. This method involves parents encouraging and reinforcing a child's sense of control over bedwetting. Moisture alarms, which detect wetness in the child's underpants during sleep and sound an alarm to wake the child. Desmopressin and tricyclic antidepressants. These medicines increase the amount of urine that the bladder can hold or decrease the amount of urine released by the kidneys. Suggestions for treatment options according to the age of your child. Ages 5 to 8, help your child understand that wetting the bed is a normal part of growing up. Encouragement and praise may be all that is needed to help your child wake up before wetting. Ages 8 to 11, if your child still wets the bed, a moisture alarm may be a successful treatment option. Also, a medicine such as desmopressin can be helpful for occasional overnight events such as camp or sleepovers. Ages 12 and older, there can be significant emotional effects if bedwetting persists at this age, so treatment can be more aggressive. If consistent use of moisture alarms does not work, the doctor may suggest medicine and/or counseling. Bedwetting alarms. A bedwetting alarm consists of a small sensor and an alarm. The sensor is attached to your child's underwear and the alarm is worn on the pajamas. If the sensor starts to get wet, it sets off the alarm. Vibrating alarms are also available for children who have impaired hearing. When bedwetting alarms are unsuitable. Bedwetting alarms require commitment from both children and parents. There may be some situations where they're not suitable. Medication. If a bedwetting alarm doesn't help or isn't suitable, treatment with medication is usually recommended. Desmopressin. Desmopressin is a synthetic, man-made, version of the hormone that regulates the production of urine, called vasopressin. It helps to reduce the amount of urine produced by the kidneys. Banish the blame. Getting angry with your little one and punishing him for wetting the bed will only add pressure to stay dry and will make the problem worse. Talk to the pediatrician. Tell your pediatrician about the bedwetting, so she can track your child's progress and offer suggestions for handling the situation. Encourage bathroom trips before their bedtime, and yours. Make sure your child goes to the bathroom before her bedtime, but also try carrying her to the bathroom again right before you go to bed. Create an incentives chart. Consider adding a positive incentive, which can work on a subconscious level, to help your child end bedwetting. For instance, make a grid chart or use a calendar, and give your child a sticker, like a shiny star or a happy face, every night he stays dry. Check for constipation. Constipation is a common cause for bladder problems. When the rectum, located just behind the bladder, is filled with large or hard poop, there is more pressure on the bladder. Consider specific medications. Medication is also an option, but it has potential side effects. For instance, desmopressin, which reduces urine production, can cause headaches, facial flushing, nausea, and, in rare cases, severe water retention. Purchase a moisture alarm. A moisture alarm wakes your child the second he wets the bed. Invest in a waterproof mattress. If moisture alarms and medication aren't for you, you can try simpler measures. Make sure the bed has a waterproof mattress cover or pad and pillowcases, and stock up on pull-ups. Bedwetting prevention. Learning to use the toilet is a natural process that occurs when children are old enough to control their bladder muscles and to know when they are about to wet. It is normal for young children to have accidental bedwettings while they are learning to control their bladders. You can help prevent or reduce bedwetting by limiting your child's fluid intake in the evenings. Do not give any drinks containing caffeine, such as cola or tea. Also, remind your child at bedtime that he or she should get up at night to use the bathroom if needed. Bedwetting, other treatment. Acupuncture. Bladder stretching exercises that teach the child to hold urine for longer periods of time. Dry bed training, which consists of following a strict schedule for waking the child up at night until he or she learns to wake up alone when needed. Hypnosis. Waking your child and taking him or her to the toilet a few times each night, or having your older child wake himself or herself a few times each night to use the toilet. It's not a good idea to have your child wear diapers or pull-ups at night on a regular basis. Using diapers can get in the way of proven treatments, such as motivational therapy and moisture alarms, that require a child to get up at night.